So, what is osteoporosis and what happens with your bone when you have osteoporosis? Normally, the cortical bone on the outer part stay the same in all of your life. All right, between adult, elderly, the cortical bone stay the same. I mean, the thickness of the cortical bone stay the same in your lifetime. But the thing that always change is the inner part or the cancellous bone or the spongy bone as a nickname. The spongy bone gonna decrease the density when the age become older and older and older. Okay, and this is the main problem that make the bone fragile and easy to fracture. So. So the meaning is that osteoporosis means it's made the bone easy to fracture. All right. Osteoporosis not make you feel pain. Osteoporosis not make you feel suffering. You don't feel anything if you have osteoporosis unless you get fractured. So that's the problem happening. All right. There's a lot of factors that associate with osteoporosis. But the most two important factor is age and hormone. All right. The age is when you have the age more than 60 or 65 years old, your bone mass will decline. All right. This is natural. On the hormone, it is very important, especially in women, because everybody knows the estrogen, right? The hormone that make you beauty and can have a baby pregnant. So when you go into menopausal period, I mean after 45 or maybe 50 years old, and you run out of the estrogen hormone, then your bone mass decline rapidly. You can see this from this graph. All right, the blue one is a graph for men. The green one is for women. So everybody, okay. So you can see this is a peak bone mass, which means everybody gonna have the highest level of bone mass or bone quality around the age of 30 to 40 years old. All right. So after 40 years old, your bone mass will decline. All right. Especially in women, as I told you, the green line. When you are older than 40 years old and you also have a menopause, the graph will be turned into the red line. Your bone mass gonna increase rapidly. Okay, so this is the most important factors about osteoporosis, which is the age. How do you know about bone quality and how can you measure your bone density? Normally you need to use this machine which we call the DEXA machine. Alright. This machine, you're gonna just only lay down and stay still. The machine will run maybe just only 5 minutes of testing, and then you know about the bone mass or the bone density that you have. Alright. No harmful, no X-ray, heart sound, or something like that. And we have this in our Bangkok hospital, definitely. Alright. The standard protocol to do the DEXA scan, you're gonna do it on both areas, on two areas. First one is the spine, the second one is the hip. Okay. We need to do both of them because if you do only one side of the measurement, could have an error. So we need to see both of the sides. This is an example when we run the DEXA scan. Actually, it is very easy to interpret the result. All right. The green one means okay, you have normal density, you have healthy bone. The yellow one means you start to have low bone mass. Okay, which we call osteopenia, okay, but not that dangerous and not that much. But if you have the red one, which means you have osteoporosis, it means that you need to receive some treatment, okay? Maybe medications or maybe another thing, okay? Depends on the doctor decision. So this is the DEXA scan when we do at the hip area, all right? In this example patients, they have the dot or the result in the yellow area, so it's means osteopenia, all right? Also, when you do the DEXA scan, you need to compare with another people in the same age, all right? So you can see it's in the upper line is the upper limit. I mean the average upper limit in the people in your same age. Okay. So this is the hip, and also this is the spine. Normally we're gonna do the DEXA scan on lumbar spine and do the average at lumbar level 1, 2, 3, and 4, and then average on the 4 levels. The same interpretation in this example, but in this spine DEXA scan, the result is in the green line. All right. So right now we can interpret that, okay, patient has osteopenia at the hip, but the normal bone density at the spine. So in general, the bone quality is still in good conditions, but okay, this patient may need to receive some supplements just like calcium or vitamin B supplement. All right. After we run all of the DEXA scan tests, we can calculate the risk of the fracture of that patient. All right. In this example patient, the major risk of the overall fracture of him will be around 9 to 6% in the next 10 years. All right, which is quite much. All right. Also, the most important fracture of the elderly is a hip fracture. In this patient, he have a chance of 3.4% that he gonna have hip fracture in the next 10 years, which is also in high level. So after we do the DEXA scan and we have the calculation of the risk, we conclude that this patient have the osteoporosis and he need to receive the aggressive treatment of the osteoporosis. All right. So another important thing about osteoporosis is you can easily to have fracture, and for most common site that could have fracture, the first one is the spine, second one is the hip fracture, third one is the wrist, and fourth one is the pelvis. So you can see that spinal fracture in elderly is the most common site. So today we're gonna focus in this area. All right. There is one term that I want you to understand. This is a new term in medical term that we call OVCF, which means osteoporotic vertebral compression fracture. This is a term that we call the patient who have fracture on spine, just only simple fall. Okay, simple fall in medical term means you just walking and then you fall. You didn't fall down from the stair or fall down from the chair. You just fall down from your height. Okay, and then you have fracture. This is the thing that we call it pathological fracture. Okay. In some patients who have severe osteoporosis, they could have fracture in lumbar spine, even no accident at all. Just like walking around, doing their own daily activities, and one day they have back pain, X-rays. We see the spinal fracture. We see this a lot. Okay, nowadays, because right now the lifespan of the patient is longer than before. Right now, patient with 70 years old, 80 years old, still healthy and still in a lot of activities, like they exercise, jogging, running, doing yoga. Okay, so we see this more and more nowadays. So, what is the symptom of OVCF? Okay, definitely. First symptom is the pain on the back. Okay, just only minor trauma or even no accident at all. Maybe it's OVCF. All right. Another thing is another symptom is loss of height. Okay. Anybody here in this room that you have loss of height recently?
You
You're
50 and now you're only...
Yeah, that's right. But if you are older than 65 or 70 years old, and you see that okay, my height is gone, my height was lost, so maybe you could have OVCF right now, but you know. All right. Another thing is that if a patient have kyphosis, or their back or the body bending forward without no reason at all. Okay, there's another signs of their OVCF. Okay. The serious sign is the neurological symptom, which is like numbness, tingling, weakness in the legs, but it's rarely to see. All right. So I have some case study and question for you guys. This is an example of the Thai woman, 75 years old. She played yoga 3 days ago, and then suddenly have back pain. This is her X-ray of the lumbar spine lateral view. Anybody sees something's wrong in this X-ray? You can raise your arms if you see something's wrong in this X-ray. Not at all? Sam?
I can see on the right hand side that there is a lot of space there, but maybe the bone structure is
You mean
worn.
here? Or here?
A little bit lower.
Lower?
Yeah, on the right now.
On the right?
Yeah, all those. Yeah.
Almost
All those
here.
dots and spots. Yeah.
Alright. Almost correct. Okay. But
I
this
think
is
I'll lock the Sam anyway. That's all right.
Alright. Okay. But this is a gas in the valve. So this is too difficult, right? Another tip. Okay. So, alright, I gotta give you an answer. So this is the abnormality. Okay, this is a fracture. Actually, if you are not well trained orthopedic surgery, okay, maybe it's a difficult thing. But I understand. This is a thing that we call the vertebral fracture at the level of L2 or lumbar number 2. All right. How can I tell you that this is a fracture? Because normally, if you take a look in the X-ray, you're gonna see the vertebra in the square shape, just like this. All right, or just like this. But in this X-ray at L2 level, it's like a trapezoidal shape. Okay, maybe a little bit difficult. Okay, I'm sorry about it. But this is the real example case that I want to show you. Just only simple yoga exercise and have acute back pain, you could have the fracture on the back. All right, so this is quite an important disease.
So basically, you were very kind to me because that was nothing like that.
Yeah, this is about the gas, but yeah, you very good.
I just thought there was bone deterioration.
Yeah, sorry, God.
No problem. Thank you. Be quiet, Sam.
Okay. So if we talk about the treatment of the OVCF, we talk about the treatment of the two problems together. All right. The first problem is the osteoporosis. The second problem is a fracture. So actually, it's two separate problems, but we need to treat it together. All right. So the treatment protocol for osteoporosis. This is a standard protocol. We need to supplement you by the calcium and vitamin D, okay, which is the main factors and main ingredient of your bone. The second thing is maybe the patient needs to use bone building medications, which means that some extraordinary medications that rapidly the process of the bone growth or bone degeneration. Okay, we not use in every patient, but in just only some patients that have a severe osteoporosis. Also, right now, a lot of articles on the journal recommend that regular exercise, any exercise, okay, just like just only running, swimming, everything can increase bone mass, and also sunlight to your body, to your skin, to produce a vitamin D regularly is very important. Also, in very old patient, I mean more than 80 years old or something, they need to practice about fall prevention. Just like learn how to walk correctly, learn how to walk without falling, and prepare their home, like the toilet, the stair, everything. Okay, everything needs to have an education to prevent falling. And 90% of the patient falling down in their own house, correct? So this is the first problem in osteoporosis. The second problem is a fracture. Okay, normally we have three protocols for the treatment of the vertebral or spinal fracture. The first one is the bracing. Okay, brace or orthosis have a lot of model, have a lot of stuff. But this is the most common brace that we use nowadays, which we call the G-wave brace. It can prevent you from friction or bending forward, so it can prevent further damage or further kyphosis on your spine. If you have vertebral fracture, you're gonna need to use this brace for at least 3 months. Okay, and normally we recommend to wear it all the time. Take it off just only when you take a shower or when you lay down again. Another thing is cement augmentation. This is very easy protocol to understand. So you have fracture here, so we inject the cement at the fracture site, and then you have no pain anymore. Okay, it's like a magical or miracle for a lot of patients, because the pain generates from the fracture site. So we inject the cement in it, so you should have no more pain immediately after we inject the cement. All right, but this cannot be done in every case. We're gonna consider it in case by case. The last option, in case that you have severe fracture or you not respond well for the bracing or painkillers medication, maybe you need to do the surgery, which we call the spinal fixation surgery. Alright? So this is quite easy surgery. We just only put the instrument inside your vertebra and then we lock it together. So in this case, this is the fracture level, right? So when we fix it, all of it, so it cannot be moved anymore. When your spine cannot move, you have no pain. Alright? This is straightforward. So let me show you something. So for the spinal fixation, in our hospital, I mean Bangkok hospital, we use the navigation system, which we call the OR, by the shape of the machine, O shape. Alright. This is a three dimensions navigation system that we use to put the screw inside your spine. In our center, we have an accuracy of the implant instrumentation, accuracy more than 99% by this machine. All right. So That's also my presentation. Your take-home message is that right now, if you still have no back pain, but you think you're older than 60 years old, you can start to supplement your body by taking a calcium supplement. Oh, I'm writing wrong. Should be 1,000 milligram per day. Sorry, all right, 1,000 milligram, not 100. Sorry, and the vitamin D supplement should be 400 milligram per day. All right, regular exercise, any exercise is good. And do the BMD scan checking every years or every 2 years, okay, depending on how your bones healed. And go to see the doctor right away if you have back pain after falling down or just really simple fall. Alright, so thank you very much for your
Well done.
yeah.
ขั้นตอนปฏิบัติในการช่วยชีวิตด้วยเครื่อง AED ขั้นตอนที่ 1 ตรวจสอบความปลอดภัยก่อนเข้าช่วยเหลือ แล้วตรวจดูระดับความรู้สึกตัว โดยการตบที่หัวไหล่ของผู้หมดสติ และถามว่า คุณเป็นอย่างไรบ้างครับ หากผู้ป่วยไม่ตอบสนอง ขั้นตอนที่ 2 ขอความช่วยเหลือโทร 1724 แล้วไปเอาเครื่องกระตุกหัวใจด้วยกระแสไฟฟ้าอัตโนมัติ AED ขั้นตอนที่ 3 เริ่มทำการกดหน้าอกให้ถูกวิธีโดย 1. หาตำแหน่งวางมือบนหน้าอก 2. กดลึกประมาณ 2 นิ้วและให้หน้าอกขยายกลับสุด 3. กดเร็วอย่างน้อย100 ครั้งต่อนาที ขั้นตอนที่ 4 เมื่อเครื่อง AED มาถึงทำการติดตั้งเครื่อง AED และให้ผู้ช่วยอีกคนกดหน้าอกระหว่างติดตั้งโดย 1. เปิดเครื่อง AED
เครื่องทำงานปกติ
2. ติดแผ่นวิเคราะห์สัญญาณคลื่นไฟฟ้าหัวใจ กดหน้าอกต่อเนื่องตลอดเวลาที่ติดตั้งเครื่อง AED 3. ปฏิบัติตามคำแนะนำในการใช้งานเครื่อง
ห้ามแตะต้องผู้ป่วยที่กำลังทำการวิเคราะห์ให้เริ่ม CPR
หากเครื่อง AED แปลผลว่าจำเป็นต้องทำการช็อคไฟฟ้าผู้ประสบเหตุ
แนะนำให้ทำการช็อค
ให้ตะโกนถอยห่าง
ห้ามแตะต้องผู้ป่วย
และกดปุ่มช็อค
กดปุ่มช็อค
หลังจากช็อคเสร็จให้กดหน้าอกต่อทันที หากเครื่อง AED แปลผลว่าไม่จำเป็นต้องทำการช็อคไฟฟ้าผู้ประสบเหตุ
ไม่แนะนำให้ช็อคให้เริ่ม CPR
ก็ให้ทำการช่วยฟื้นคืนชีพ ด้วยการกดหน้าอกอย่างต่อเนื่อง และประเมินอาการซ้ำทุก 2 นาที ช่วยเหลือจนกว่าผู้ป่วยจะตอบสนอง หรือจนกว่าจะมีเจ้าหน้าที่มาช่วยเหลือ เพียงเท่านี้คุณก็สามารถช่วยอีก 1 ชีวิตได้อย่างทันท่วงที ด้วยความปรารถนาดีจาก